Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Lidocaine. Lidocaine is class 1B drug. It is the least cardiotoxic drug. And this lidocaine is actually a potent sodium channel blocker. Lidocaine is ECG neutral drug. The half-life of lidocaine is around 1 hour. Lidocaine has high volume of distribution and mainly in patients with heart failure. If you give lidocaine in patients with heart failure, in them the volume of distribution of lidocaine and also the clearance of lidocaine decreases in patients with heart failure. But in normally, lidocaine has high volume of distribution. Lidocaine undergoes metabolism, and on metabolism it results in formation of two compounds. It forms On metabolism, lidocaine will form glycine xylide, and also monoethyl it forms monoethyl glycine xylide. So ethylene so lidocaine undergoes metabolism and it forms glycine xylide, and it forms monoethyl glycine xylide. So uses of lidocaine. Lidocaine is the drug of choice for certain conditions. Lidocaine is the drug of choice for ventricular arrhythmias. It is the drug of choice for ventricular arrhythmias, and it is the drug of choice for ventricular fibrillation, and it is the drug of choice for digoxin induced arrhythmias and anesthesia. Also in the anesthesia we can use lidocaine as local anesthetic, and also in anesthesia induced associated arrhythmias also we can use lidocaine. Lidocaine is also used in arrhythmias which are seen in ICUs. Also we can use lidocaine. Lidocaine is used in acute myocardial infarction induced arrhythmias. So lidocaine can be used in many types of arrhythmias. Lidocaine is actually the drug of choice for termination of ventricular tachycardia, and it can be used for prevention of ventricular fibrillation also. Lidocaine can also be used as local anesthetic. As the local anesthetic, lidocaine is used as a local anesthetic, and we can also use adrenaline can be used to prolong the action of lidocaine. Then side effects of lidocaine. Lidocaine can cause certain side effects like lidocaine has toxic metabolite. The toxic metabolite of lidocaine is monoethyl xylidine is the toxic metabolite. This will result in neurotoxicity. The neurotoxicity due to monoethyl xylidine is actually treated by diazepam. The earliest manifestation of lidocaine is by it can cause perioral numbness. It can also cause facial twitching, and this can also result in frank seizures also. Lidocaine can result in perioral numbness, facial twitching, and frank seizures.
thank you and thank you for watching.